Hello, everybody. Good afternoon. Today, I'm going to talk about bovine mastitis. And I assume most in the audience are not trained veterinarians. So I'm trying to give you a quick introduction what bovine mastitis is. As a definition, bovine mastitis is a polymicrobial disease that manifests as an inflammation of the udder. Now, for the cow, such an inflammation is very painful. And mastitis is very common, and so it has a significant effect on dairy farming. The polymicrobial bit means that a number of pathogens can invade the udder, can infect the udder tissue, and eventually cause an inflammation. Economically, the most important ones are Staphylococcus aureus and Streptococcus uberis. And today, I'm going to focus on mastitis caused by Staphylococcus aureus. Now, a very important term in mastitis is the somatic cell count. This is the number of immune cells that is present in the milk. A healthy cow has approximately 50,000 to 100,000 cells per milliliter of milk. And that is nature's way to provide the calf with some form of immune protection before the immune system of the calf is fully functional on its own. Now, if there is an inflammation, this number will increase rapidly and can reach several million cells per milliliter. Now, the dairy looks at this somatic cell count from a different angle. They argue that if the cell count is high, there must be a pathogen present in the milk, and so the milk is no longer safe. And the dairies will set a threshold level. This threshold can vary from dairy to dairy or from country to country, but it means if the milk or the somatic cell count of the milk is above this threshold level, then the dairies will reject the milk. So the farmer can no longer sell this milk. And that is a big problem for a farmer because to feed a cow very quickly becomes unprofitable if you can't sell the milk. So the farmer will turn to the vet and tell him, cure this cow. But we are living in a world where many bacteria in the outside world are already antibiotics resistant, some of them multi-drug resistant. And so the task of the veterinarian to curing this cow becomes more and more difficult. And this is now really bad news for the cow, for the vet, and for the farmer, because a cow that cannot be cured with mastitis will be prematurely culled and with a lot of losses for the dairy industry. And now, as we're in a phage, it's clear we would like to use bacteriophages to solve this problem. How are we going about that? We are definitely not the first one who tried this. If you want to read about that, I can recommend this review article by Janet Nail. But we said we want to have a go at that anyway. So first question, do you have bacteriophages specific against Staphylococcus aureus? Yes, we find them. Many people around the world found similar phages. And very good for us, they're lytic, so we can use them in a therapeutical application. The question is, are they active against Staphylococcus aureus strains that cause mastitis? And we can use steamroller tactics and just make a spot test and score these positive interactions. We can also do a more sophisticated efficiency of plating assay. And combining this information, we can compose a bacteriophage cocktail that covers mastitis-relevant isolates. And as you see, if you take a 3-phage cocktails, we have about 60% coverage. But if we use a 5-component phage cocktail, we cover 97% of the mastitis-relevant strains. That is pretty good as a start. So the next question we asked, are these phages stable and active in raw milk? raw milk is really not the LB gross medium we use in the laboratory. It has fats and antibodies, and as you just heard, a lot of immune cells that could potentially inactivate a bacteriophage. And some people who tried to cure mastitis had troubles with this stability in milk. And so we made our analysis and we find short-term stability, so 12 hours, 24 hours, that's fine. And we find the phages are active. We see an about 1 log reduction of Staphylococcus aureus in 1 hour. Now, 1 log reduction is not really that great. We would have preferred 3 log reduction, but that's what we observed. We thought that's good enough to think about an experiment in vivo. So the question, how do we approach a cow? No matter how many phages you feed a cow, these phages will not reach the udder of the cow. They will be lost in the digestive tract. The same if you just use another wash or another dip, you will not reach a therapeutically active concentration within the udder of the cow. So the only option we have is actually to inject the bacteriophage product into the teat channel. The moment you do that, you are a veterinary medicinal product, no questions asked. So how would we apply it? We do need some diagnostic. So the farmer has to detect, oh, there's a mastitis developing in this cow, and then the veterinarian has to identify the causative agent, and only if that's Staphylococcus aureus, then injection of bacteriophages specific against Staph aureus would make sense. If it's caused by E. coli, it wouldn't make sense to inject Staph phages. Once the diagnostic is done, we then would treat the cow. The farmer would start and milk the affected quarter, so basically empty the affected quarter, and then the veterinarian would inject the phage product, and then the cow will take the part, and over a period of 12 hours, the udder will slowly fill with milk. And in this 12-hour window, the bacteriophages will have time to attack any Staphylococcus aureus that might be within the udder. We repeat that several times. A single application might not be enough. So the question is, does that work in vivo? So we started a very small field trial with 2 cows. These 2 countrywomen of mine were used as guinea pigs. They're standing on a hill in the Bernese Emmental. That's where the real Swiss cheese is coming from. And we can see even in cow paradise, mastitis does occur. And so we did the diagnostic. Both cows tested positive for Staphylococcus aureus. And then we treated them, and we found very shortly, like 6 days after the treatment, Staphylococcus aureus was no longer detectable in the milk. The inflammation parameters disappeared very, very rapidly, and no relapse occurred. Now, if we look at that in terms of somatic cell count, we see that Lily was absolutely fine for the first 150 days. Apparently then she got infected with Staphylococcus aureus. The somatic cell count increased rapidly to about 4 million. And the farmer immediately treated this cow with an antibiotic, kanamycin. But obviously the antibiotic didn't do its job, so the situation got worse. Now, if you have a cow at this stage, the cow will very quickly be culled. And so the farmer said, okay, you try the treatment with bacteriophages. If not, the cow will be culled. And so we did the treatment, and we see the somatic cell count drop to normal levels very quickly and then stayed there. For the second cow, very similar. The first 120 days were fine. Then it apparently got infected with Staph aureus. And this time the farmer did not treat with an antibiotic, but a mastitis doesn't go away if you simply ignore it. So the situation got worse. We treated the cow when it was above 6 million somatic cell count. Very quickly, the situation improved and stayed down there. Now you can argue 2 cows is not really such a big sample size. So we started an official field trial, publicly funded, and we have some partners from Copenhagen and from Hanover. These are trained veterinarians who know how to handle cows and how to run such a field trial. We already have the result that our product is safe, and for all else, stay tuned. Now, how do we produce such a bacteriophage product against Staph aureus? I do not have the time to go into detail. This is a very standard production scheme. We might hear from our next speaker a little bit more about it. At the end of it, we have a sterile solution that is packed into a syringe, and we use a soft tip injector so the teat sphincter of the cow is not injured when we inject into the teat channel. Right now, at PTC, we have a production capacity of about 400 liters of bacteriophage product per week. So we could produce enough product to treat 13,000 quarters, or divided by 4, that many cows if all the quarters would be infected. So we can run quite a large field trial. And now another point I would like to make: how much would such a product cost? Our argument was that it should be in the same price range as an antibiotic treatment to actually be accepted in the market. And if we look, antibiotic treatment, depending of course on the antibiotic, costs about 30 to 80 euros per cow. And with our cost calculation, we say a treatment of 1 quarter would cost about 25 to 30 euro. If we treat all 4 quarters, about 100 euro. Now, would that make sense for a farmer? If we look at the meat value of a dairy cow, that's about 2,500 to 3,000 euro. And the potential of a healthy dairy cow producing milk in 1 lactation period, that's another 2,800 to 3,500 euro. So the investment to cure a cow of this sum would actually make sense. Now, what's the stage of the product? The EMA published a guideline on the quality and safety of veterinary medicinal products. So we now have a guideline to go along. At the moment, there is no veterinary medicinal product registered in the EU. There might be a reason for that, but that I will not be able to discuss today. And so, thank you very much for your attention. If there is time, I'm happy to answer a few questions.